My name is Angela Stewart. I am an advanced practice nurse here at Highlands Oncology Group. Started in June of 2009. As advanced practice nurses, a lot of what we do is taking care of patients' needs as far as when they're in chemotherapy, basically managing any symptoms that they may have. We do see initial hematology patients with the physicians and kind of come up with a plan for them treatment-wise if they need any further treatment. But most of the time we see patients in follow-up throughout their chemotherapy and even after they're through with chemotherapy doing, follow-ups every 3 months or 6 months or however. And just managing symptoms like nausea, vomiting, diarrhea, We have a lot of services. We have a great staff. The first thing we do is just kind of try to get, the patients familiar with their diagnosis and the treatment options that they have available, and kind of let them, have all the information so that it can kind of guide their decisions as far as, which way they want to go as far as their treatment and what we think is probably the most appropriate treatment. But we have chaplain services here. We do have a coffee shop for people who have really long therapy regimens, because some people's are an all-day-long therapy. As far as the staff, we just try to take care of any needs that they have, when they come in the door. I love the patients the most. We see them more frequently than any other clinic, just because the chemotherapy is, pretty hard on patients, especially, their blood counts will drop, a certain time afterwards, and so we monitor that closely, and their symptoms as well. So a lot of patients we will see weekly. And so you get really close with them, you get to know their families, you get to know their dogs, and they become like basic, extended family. And so, it's a blessing to take care of them, because they're going through a rough time, and so we try to make it as pleasant as we can. It is awesome. We have a great group of physicians. They all have their little, personalities, but they're unique in their own way, but they're all wonderful, very nice, compassionate, understanding, easy to get along with, and they want the best for their patients. And I think that shows. We provide CT scans, because patients often have to get scans routinely to see how their treatment is going. We do MRIs as well, so we generally, if patients, need an MRI for something else, if something happens to them, and they have, shoulder pain or something, and we're addressing something else, we could always do an MRI of their shoulder to see if maybe something's going on there, to refer them to the appropriate physician, things like that. We have the only PET scanner in Northwest Arkansas, and we actually have one here and up in Rogers. And so, and we have electronic medical records, and so the technology is great. As far as people who are searching for somewhere to go, I would highly recommend coming here, just because of the services we provide and the compassion that our staff, with the nurses as well as the physicians, and we all work together as a team, and it's an excellent place to work. And that's the main reason I even came to work here, because I had always never heard of anybody that didn't absolutely love their job here. And so, and our goal is to, make the patients, feel comfortable and try to keep them, their quality of life as best we can while they're going through, a really rough time.